Hi everybody, I'm Nancy Bell with the Virginia Department of Health. Coming to you today to talk to you a little bit about the coronavirus, give it a local twist, give you some resources where you can find more information and hopefully take your calls and questions. So without further ado, we'll jump right in. First of all, the district that includes Franklin County also includes Martinsville, Henry County, and also Patrick County. We consider ourselves the West Piedmont Health District. There's been some confusion about what the health department's role is in the epidemic, so I'd like to clarify that first and then we'll jump right in and look at some numbers. The health department's role is to educate the public about avoiding disease and illness, but also to collect data and do contact tracing. What that means is if we have a person who has tested positive, we do an interview with them and try to locate everyone they've come into contact with and let those people know that they've been exposed and give them some recommendations for keeping themselves safe, but also from helping it spread in the community. So let's look, we have a couple of websites here I'd like to take a look at. The first one being from the Virginia Department of Health. And I just want to show you all the resources that you have at your fingertips. And by the way, this site is updated daily by 10 o'clock with the new numbers and new questions and answers and all kinds of information. So if you have time and you're sheltering at home, this is a really good place to look. So the website is vdh.virginia.gov/coronavirus. That's pretty simple. If you just happen to land on the VDH page, there's a link to it at the top, so you don't have to worry about remembering this. So this is what the dashboard looks like, and every morning the numbers change. In the Commonwealth of Virginia today, we have 58,354 cases. I'm sorry, number of people tested. The number of active positive cases is 9,630. And then you can look in the next box and see the hospitalizations, and finally the total number of deaths. Here is a key, and you can actually stop on your county. Here's Franklin County, and it says as of today we have 16 cases, 2 are currently hospitalized, and 0 deaths, which is a really good thing. You can also look at it visually. You can go see if you have loved ones who live in another part of the state. You can go to all the districts. It goes down by county and city and find the information. So there is a district called Piedmont. Be sure to skip over that. We are West Piedmont. And I'll show you what that looks like. There's West Piedmont. And here again, you could, well, sorry, didn't mean to click on that. You see Franklin County with 16 cases, 2 hospitalized, Henry and Patrick. And again, I can check on my family in Tidewater and see how they're doing there. Then if you really want to get into it, they have cases by the week the illness began here, by date, and then they have, as you can see, we're really teeny in the scheme of things down here. This is talking about outbreaks. So our cases have been very isolated. This chart is for hospitalizations by district. This is age grouping and by sex. So any information that you wanted to know is basically on here in a number of different ways. This also has outbreaks. And as you can see, the national news has pointed to long-term care facilities continue to be the most at risk for having outbreaks. They also have healthcare settings, correctional facilities, and educational settings, which this time of year mainly refers to college campuses. So that gives you a quick snapshot of what's going on. You can also come and download data by week and by topic. These are public use data sets by sex, race, age group, hospitalization. And then the VDH has done a really nice situation summary that talks about the history of the virus, when we first knew about it, when it came to United States, when it came to Virginia, and how it's progressed throughout the time. And again, you can come on here and they'll give you the recommendations, what to do if you're sick, It has some recommendations for that. And all of these are written in pretty straight language. They have, if you're a higher risk at getting sick, well, what does that mean? You can click on the link and it actually tells you who is at higher risk. And it's people 65 years or older, living in a group setting, have underlying medical conditions, just about everything you would want to know. As it talks about older adults and people with asthma, things you can do, and there are frequently asked questions that are updated almost every day. So if you are an employer, there are things on here for you to pass out to your staff. We have guidance on what to do if someone at your plant or place of business tests positive. But again, the health department's role is to help you clarify that. So if you have illness at your place of business and you want some guidance from us, you can actually give us a call at the local health department and we can help troubleshoot that for you and make sure you're following the precautions. The other website I want to show you is the actual CDC, and this is cdc.gov/coronavirus-19. And again, how to protect yourself. Has printer-friendly versions if you want to pass these around at church or share them with your groups or your families. It has an understanding of how it spreads, and hand cleaning, close contact. Let me take a minute to talk to you a little bit about masks. There are a lot of people out there making cloth masks and all kinds of, I have one with trolls. They're perfectly fine. The only people who need the medical grade mask are the medical professionals themselves. So we're advising folks to not buy all those up unless you're in a circumstance where you're around someone who's been exposed. This is the N95 mask you've been hearing so much about on the news. It fits over your nose and mouth like this, and then you can pinch so that it fits. No mask is going to do you very much good if your nose is sticking out the top or your bottom lip sticking out the bottom, or it's off to the side. Make sure, whatever you do, to cover those main areas. You can use a bandana, just make sure that there are no openings at the bottom. We have learned today that the cough and sneeze of a person who's infected can go as far as 12 feet. The original guidance was 6, and that's bad enough, but these masks are really going to save lives, whether you are sick or not. Please, when you go out in public, try to wear the mask. We have some guidance on gloves too, and I think the best way to look at that is pretending that everything you touch has glitter on it. So I'm going to pick up my friend's cell phone, and it's got glitter on it, and now the glitter's on my hands. I get sidetracked and I go pick up my phone. I now have the virus, the glitter on my phone. I go to put on my mask. I have the virus on my mask, my pen, my computer. You get the idea. So if you wear gloves into the grocery store, for example, be sure when you come out to your car, before you get in your car, you remove the gloves, because if you don't, everything you touch, the steering wheel, the shifter, all of that seat belt, it's going to have the virus on it. So still, we're recommending the very thorough hand washing. And again, when you wash your hands, think of that glitter. Get in between your fingers, top and bottom, the nails. This is the number one thing you can do to not accidentally infect yourself. The virus enters your body through mucous membrane. So if you happen to touch your lips or your mouth, your nose, your eyes, you can transmit the virus that way. It's very easy to do that. And the virus lives on surfaces, some surfaces, for days. So again, keeping your home and frequently touched surfaces clean with Clorox wipes or Clorox on a Clorox and water solution with paper towels, whatever you have at hand, that's a really good thing to do. Let's see what else we have here. And feel free to call the station if you have questions. We will try to answer them today. That's pretty straightforward. I think you could get lost in these websites. One thing I would like to point out is that this is an ever-changing situation, and sometimes rumors get out in the community. One that we had to deal with pretty early into the outbreak was that one of the local employers in Rocky Mount had several sick people there at the plant, and that workers were afraid they were going to catch the virus. We received phone calls from the public, and so we did our due diligence as a health department, and we made it a surprise inspection, and this employer was doing everything absolutely correctly. There was good hygiene in place, there was social distancing, they had written a policy that was actually so good that they allowed us to use that to share with others. So please, if you're hearing things that don't sound quite right or seeing things on social media, be sure to call the health department, and we can tell you whether that's fact or fiction. In terms of what exactly we can tell you, we can tell you the person's age, the decade, their sex, male or female, and the county or city that they live in. So we can say this one's in Franklin County or Henry County. When we have a death, the statute of Virginia limits us a bit more, and we can only report the district. So if we had a death in Franklin County, we would report that as West Piedmont Health District. That is mostly to shield the families of who have lost loved ones in the pandemic. Do we have any questions, Kevin?
What steps should someone take if they feel like they have symptoms? So if they think they have symptoms, what should they do?
Okay, that's a great question. If you feel like you might have the virus, the first thing you should do is go home and isolate yourself. Make yourself comfortable and treat yourself like you would any flu. You know, there's a large tendency of folks to want to run out and get a test, and truthfully, your treatment is not going to change whether you have a positive test or not. So you go home and you treat yourself like you would any flu, and if you have several days of sustained high fever, or if you're losing your sense of taste and smell, or if your throat is getting scratchy and swollen and closed and you have difficulty breathing, or if you just feel like you're sicker than you've ever been and would like to seek medical attention, the advice is to phone or email your doctor. Do not go to the emergency room or call an ambulance if you can avoid it at all. Your doctor will then probably order a test and tell you where to go, and that is a simple process. There are several drive-through sites in our area, one at Martinsville Speedway and one in Roanoke, where you can drive up in your car, they put a swab in your nose, put it in a test tube, they get some information from you, how they can contact you, and it's all confidential. You will get the results from your physician, not from us at the health department. So, and then your physician can advise you as to next steps. I am assured by talking to Carl Klein at the hospital that we have ample bed space and personnel to take care of a virus in our community as it is currently growing. Of course, if we had epidemic proportions, we would have to reach out to the Medical Reserve Corps and make some other measures. But from all the data that we have seen, we're in good shape in Franklin County, and we're all hoping to see the downward curve certainly by the end of May.
What is the rate of spread currently? Have we flattened the curve locally, or is it still the same?
We have gone several days in Franklin County without having a positive case, and I find that that to be very telling. And we've had no deaths. So in our area, we do seem to be flattening the curve. We will need 2 weeks of not having any cases reported or no deaths to call it the downside of the curve.
Are the measures at the local stores doing anything? Like you see the plexiglass that's up in some places. That is that actually any help at all, or just a little bit of help, or what's the situation?
I think that's it's a precaution, just like gloves and masks.
Can you repeat the question?
Oh, I'm sorry. The question was the plexiglass barriers at grocery stores and gas stations and so forth. Are they doing any good? And my answer will be yes, because anything and everything we can do to socially distance and to keep bodily fluids from being exchanged, even in a simple sneeze, is a good thing. You know, there are some of us that don't have the privilege of working at home or staying out of the fray during this pandemic, and we have to do everything we can to protect those folks. And if a glass partition, plastic partition is something that will help them, then by all means we need to have those.
Is it true that getting the hand sanitizer to naturally dry and evaporate, is that what actually kills the virus instead of just, you know, not letting it dry or whatever and not leaving it on there long enough?
So the question is about hand sanitizer. Do you really have to get it dry for it to be effective? And here's what I always say. Anything that's sticky and moist is going to attract germs and viruses, not detract. So you want a hand sanitizer that has more than 50% alcohol content to it, like the ones being manufactured at Twin Creeks Distillery. And you want to make sure to work the stuff in between your fingers, under your rings and jewelry, and down to the wrist area. And then you do, in fact, want to let it dry. This is not a health department recommendation, but personally, I carry disinfecting wipes in my car, and I use those on my hands throughout the day. Now, it causes you to have very dry hands. Those of us who are washing our hands so much during the day know that, but I feel that that's a very safe way to keep your hands. And I wipe down my steering wheel. If I go to the gas station, I'll wipe down my hands after the pumps before I open my car door. And I was telling my grandchildren had questions about this, and I don't know how many of you remember going to the dentist and getting the red tablet to bite down, and it would show where you were doing a good job of brushing and not. I asked them to imagine that on their hands. You know, if you're not getting down in between those fingers, that's where the red stuff is going to be. So I think it helps children understand, and to give them songs to sing for the purposes of washing their hands.
Nancy, do you know, and I might have missed this, when you make your own hand sanitizer with the aloe gel and the alcohol that you're supposed to kind of put together and the whatever scent you want for the essential oils, do you know what the parts ratio is, how much of one would need to go into the
Okay.
recipe that goes?
I've been asked for the recipe for hand sanitizer, and I don't know. I know that they like 50% or more alcohol content, but I'll bet you Twin Creeks can tell you the distillery, as you know, has turned over to making hand sanitizers that they are giving to the public. And I'm sure there's some place online where you could Google a recipe for hand sanitizer. They certainly have instructions for making homemade masks. So I think it would be safe to just check on the World Wide Web to find that information.
Can you have coronavirus, go through the whole virus yourself and not even know it?
Yes. The question is, can you have coronavirus and not even know it? And that is yes. That is what's so scary about this particular virus. You can be asymptomatic, meaning you have no cough, no fever, and you can give the virus to other people. And that's why all the hysteria about wearing the mask and the gloves. Not just to protect yourself. If you're a daredevil risk taker, think about the other people, the expectant mother or the newborn infant or the elderly person or someone with the compromised immune system. They are at greater risk, and you don't want to be the reason that they should get sick and possibly die. We had some guidance today that people who have been sick with coronavirus can actually shed the virus 6 weeks after they've been declared well by their physicians. So it's a nasty virus, it's a tricky virus, and common sense just has to prevail if we're going to get on the other side of it.
Go over again the length of time, maybe, if you haven't gone over it, that the virus remains airborne or on the surface.
Okay.
Like if somebody sneezes, how long can it be in the air for?
Okay. The question is about sneezing and surfaces and the activity of the virus. We still don't know exactly. We had suggested at the beginning that 6 feet away is the proper social distancing, but we can see that some people who really cough and really sneeze can send it out 12 feet. Not the norm, certainly, but something to be aware of. The virus lives different lengths of time on different surfaces. unlike many viruses who don't like the cold, this one doesn't mind the cold. So your refrigeration and those sort of things aren't going to take care of the virus. On metal and porous surfaces, it can live for days. And that's why I say don't put hand lotions and oils and things on your hands, because you're just going to pick up viruses from surfaces that have maintained the virus. They're doing a lot of studies on this, and if you check the CDC website, almost every day they've updated their recommendations. And I would like to add that even though we're getting recommendations from CDC and VDH, the local health department staff is here to help. We have call centers, and it's just calling the main number at your local health department and ask for someone who can answer questions about the coronavirus. We'll get someone on the line with you, and you can ask your questions, and if we don't know the answer, we'll do the research and we'll call you back.
What's that number again?
The number at Franklin County Health Department is 484-0292. 484-0292.
Spoke earlier about the rumors going around on social media. I saw one today, or I've seen lately here about the vaccine for a different strain years ago. Can you go into maybe some detail about how it's not the same strain that folks are seeing on the Lysol can?
Yes, okay. So the question is about existing flu vaccines and vaccines we developed for other strains in the past. As I said, this virus is a booger. It's its own animal, and it does respond differently in different people. So there was a vaccine for malaria, I think, that had great promise, but the testing that's going on indicates that it can actually be harmful. There's some trials going on with antibodies of people who've been infected to see if that is the basis of a vaccine we can put together. It's just going to take time. We have to make sure we don't give the public something that's going to harm more than help. And that's why, you feel like we're telling you the same thing every day, to wash your hands and cover your face. It's all we can do to really, that's the barrier that we know that will work.
Do you guys find that folks are having trouble with the mental part of this in terms of their own mental health, getting more depressed, suicidal tendencies, things of that nature? And how do you balance that reality with
Okay. That's a great question. The question is about mental health and how people are coping with the virus. I know that it's something probably you've not heard of, but there is a such thing as tele mental health, just like telehealth, where you can call a professional and get some advice. But basically, this is how your life has changed. Humans are social animals, and we're all of a sudden shut in. I live alone, so since the beginning of March, I've been working and living at home in isolation, coming out once a week for things that I have to do for my job. And it gets very depressing. You can look out the window and see families that are outside exercising and enjoying airtime together. And if you have a family, you may also be feeling overwhelmed. The children are getting on your nerves. You're trying to help educate them. You're still trying to go to work. You're trying to find time to get groceries, keep everybody clean and safe. It can be very stressful. The financial stress is immense in some families, and all of this is real. We do have mental health counselors in the community, and your number one call should be to Piedmont Community Services. They have a 24-hour answering service, and there's also a national suicide hotline. They will talk to you even if you're not suicidal, but you're just really depressed. They will give you some resources and things that you can do. We do know that exercise is a great defender of depression, so even if it's walking around your apartment or walking up and down your stairs, that is also a way to fight the virus. The research is showing that physical activity is making people more immune to the virus.
Can my cat get the coronavirus?
If-
That was discussed earlier, and then it seems like I think I heard something about a tiger or somebody getting it, or an animal, but what's the latest on it?
Okay, the coronavirus, there's no evidence that it can be shared with your pets or that your pets can share it with you. Now, pets do get corona-type viruses. They get stomach viruses, and a phone call to your vet should put your mind at ease in terms of what they have and whether they can spread it to you.
And the same question, but as far as like age groups, small children, people maybe not that elderly, but just general population,
Okay.
younger.
The question is about age group and the virus. And initially they said if you're 65 or over, you are at high risk. But we've now seen young people, and we've now seen very young people, children, contract the virus. And there seems to be some evidence that if you catch a light case of it, you're mildly exposed, you generally survive and can take care of things at home. If you're, like as in the case of some of our healthcare workers, if you're exposed on multiple levels and get quite a bit of the virus, it can be deadly. But anyone with any breathing difficulties, if you're a smoker or a vapor, you're going to be at higher risk, because this is a virus that just wrecks your lungs. It crystallizes and makes them sticky, and it's hard to breathe, and you need a respirator, and sometimes you don't come back. And that's very unfortunate. But I'm pleased that we've not had deaths in Franklin County, and I think we can thank our local health care folks for that.
A lot of states are trying to reopen some business to the cries of some folks that are protesting. Is it possible that we could see a even more severe wave if that happens, or I know the answer to it, but I just want to let you kind of elaborate.
Sure. The question was about having the virus level out and decline here, and when we should open business. And it's such a tricky question, because we all want to get back to work. We want the economy to be fine, and now we're facing going back to work and possibly causing the curve to go back up. I, as a citizen of the Commonwealth of Virginia, am listening to the governor's guidance and following what the recommendations are, because I don't want to be part of the problem. I want to be part of the solution. If all we're asked to do is change our lives for a few weeks to get on the other side of this and save your life and many others, then I feel we need to be prepared to do that. Are we done? All right. Thank you for having us here. We'd like to come back, so if you have questions, we can answer them next time. And again, your local health department is here to answer your questions and help you any way we can. Thank you.